Today, we're going to talk about teeth grinding, also known as bruxism. And it is a condition where people clench or grind their teeth unconsciously and often unknowingly when they're awake and mostly when they're asleep. And it can happen in both adults and children. And if left untreated, it can cause a host of problems. I was taught very little about tooth grinding and clenching in school. What I was taught is that a night guard is what you prescribe to keep from breaking the teeth or causing damage. So a lot of times you can, if you're clenching or grinding, you can break a tooth, chipped tooth, recession, or abfraction, where now the root surface of the tooth starts to show. The crown part of the tooth is made out of enamel, and that is the hardest surface in your body. And it can take a lot of abuse before it breaks, cracks, gets a cavity, or worse, you need a root canal or you need a tooth taken out. And what can happen is this recession can be caused from scrubbing and brushing too hard, but it can also be caused from traumatic occlusion, meaning that your teeth don't touch together properly. So if your teeth are out of alignment, if they're crowded, if you have a tongue thrust and you're pushing your teeth, that's something that can create an issue that can cause other problems. And this is why you want to know, are you doing this? And a lot of times it's unconscious. So a loved one will tell you that you're clenching or snoring. They kind of go hand in hand. And a lot of times this night guard will help, especially if you have TMJ issues. If you see me, you can see that I have a pop on this side, but it deviates to this side. So when we do myofunctional therapy, that's one of the things that we look at is what is happening with their jaw. So what they think the cause is stress, anxiety, depression, teeth being out of alignment. But an occlusal guard really is just treating the symptoms and preventing your teeth from breaking. But what is the actual cause of why you're clenching and grinding? So it could be stress, could be anxiety, could be that you're really tightly wound. That's what it was in my case, and I couldn't relax. But a mouth guard actually just treats the symptoms. So we want to look, is there something that is more of an issue? Is your roof of your mouth too narrow, too vaulted? Is there not enough room for your tongue? Are you trying to find a place to put your tongue? Is it your tongue blocking your airway and the clenching is moving your jaw forward, or you have this forward head posture to get your tongue out of your airway because it's too big for the space? And so these are all things that we want to evaluate to see why are you clenching and grinding and what's going on with you, especially people that wear CPAP machines, because a lot of times they need CPAP machines in the first place because they can't breathe. But what is the cause of not being able to breathe? Is it a deviated septum? Is it polyps? Is it your adenoids? Is it your tonsils? So these are all things we want to look at versus just treating the symptoms. So if you have any of these issues, please speak to your doctor, your dentist, an airway orthodontist, a myofunctional therapist, a chiropractor, a body worker. These are all things that we want. And a lot of times we all work in collaboration with one another because you can't just treat one thing. It all works together. And that, in my opinion, is the problem with our healthcare system, is that we treat symptoms and we give you a pill for a lot of these symptoms. But some of these things are really easy to fix if you know what to look for and you look for the root cause and you start from the head down. First of all, what's your mindset? How are you breathing? What are you putting in your mouth? If you're breathing through your mouth, now you're sucking in air, you're sucking in the bacteria from your mouth and it's getting into your gut, which is now affecting your gut health. And you could have reflux or GERDs or gas because of this whole mouth breathing, snoring, clenching thing. So you can see how all of this is together. And if you're snoring, clenching, or grinding, it's affecting your sleep because it's waking your body up. Even if you are not physically waking up, just a movement or just a snore like that has now kicked you out of your circadian rhythm, kicked you back into stage 1 or 2 of the sleep cycle and out of REM sleep. REM sleep is when we rest, repair, when our bodies set our memories, when we restore our health. If we're not getting good sleep, it's increasing a lot of the hormones. It's making our hormones out of whack. It increases cortisol. So if you're overweight, if you can't lose weight, if you tried everything, maybe it's because your sleep cycle is not working for you. So a lot of times they'll send you for a sleep test, but sleep tests usually test for sleep apnea. And that means that you stop breathing and you have to have so many apneic events, I think 10 or more, in order for it to be sleep apnea. So you don't necessarily have to stop breathing to have a sleeping issue or a sleep disordered breathing. So again, teeth clenching, grinding, snoring are all a symptom of a bigger underlying cause in a lot of cases. So it's really important that you look for these things and you find a provider that can help you. So if I'm that provider and you think I can help you, click the link below. You can schedule a 15-minute free call with me. You can go to my website. I have a lot of free things that you can download to kind of get to know me if you don't know me, but I am here to help you. So if I'm not your person, there is Airway Circle, there's ASAP, there's all of these places that you can look into airway, clenching, grinding. You can Google a lot of this stuff and find out if what I'm talking about is true. So again, go ahead and click the link below. You can work with me any way that you would like. If I can help you, if I can't help you, I will find you someone who can help you that works for you. I just want us to live a happier, healthier life, because in my mind, it all starts here from the neck up. So I also have a Facebook group where every Thursday I go live and we do checkup from the neck up, and we talk about different things that are happening from the neck up that are affecting your body. So that's another way that you can kind of get to know me, get to see my content for free besides YouTube, and just figure out what's going on. If this was helpful to you, please comment, like, subscribe, share. I put these videos out every week, and I do little short clips that help educate people on what is going on in their mouth that could be possibly affecting their body, their health, and a life where they're just surviving instead of thriving. Because if you can't breathe, you are just surviving. Maslow's theory of hierarchy says that if you don't have your basic needs met, you can't thrive in other areas. So if you are mouth breathing, if you're having a problem breathing through your nose, if you're clenching or grinding, it is affecting your health, whether you know it or not. Our body is great at compensating, so you don't always know what is going on, especially if you're doing unconsciously and you're sleeping, especially if you live by yourself. So hope this was helpful. Thanks for watching. Until next time.